well, in this case, I would say medications like um, acetaminophen, then that's something you should try first. Why? All the tips I'm giving you are all based on evidence, which means studies have been done to actually tell us what's better. And with headache, the medication does help a lot. And this is very common, but it's actually one of the medications that helps the most when you're dealing with a headache. Actually, it has been compared in clinical trials with morphine and very potent painkillers, and acetaminophen or paracetamol, as you call it here also. You can get it. It's over the counter. One 500 milligram pill, or I think now there's 725 milligrams. You can take it and it will actually help. It's pretty safe. Of course, I wouldn't recommend it for a long period of time, but it's very safe. I would recommend to do some pressure and some massage in the back of your head. That's what we call the Arnold points. Those are points that we have discovered that are a big cause for headaches, especially for tensional headaches after a long day at work, or maybe you're having a bad week or something like that. So I would recommend for, I don't know, a family member, your couple, whatever, to try to do pressure in those specific points you're seeing there. Another thing that might help you a lot is actually putting a band on your head, because it will prevent or help reduce the blood flow to your head, because you have two ways the blood flows through, an internal and external path. So if you block the external, the blood will only go through the internal path, and that might help you with your symptoms. So take a rubber band and put it tight on your head. Not very tight, like it's gonna actually worsen the headache, but tight enough for you to feel the pulse in the temples, both temples. Drink coffee. Caffeine is one of the best things you can actually have for headaches. Now we actually have it in pills, but having a good black coffee can help you and might help you with your headache. And putting ice on top of your head, not on the side, not on the back, but on top of your head, because cold makes the vessels constrict, and that also helps and diminishes the blood flow to your head and might help you a lot with the headache. So that's something I would recommend. And if you see that nothing's helping and maybe your headache, it's more frontal, it might be because you have sinus infection, not necessarily a bacterial but a viral infection, which is very common. So try to use nasal spray or even boiled water. Of course, you boil the water, you let it cool down, and then you put it through your nose and let it go out through the other nostril. That's something that might help you a lot and might save you a trip to the ER.